Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and André.
Welcome, everyone. Welcome to the Soft Bites podcast. Hello, André. Welcome. How are you?
Hi, Manuela. Nice to see you. Fine, thank you.
So today we're going to talk about difficult patients. So this is episode 11. And today you've proposed me the theme and for us to talk about dealing with difficult patients. And when I was thinking about it, I've decided to, the first thought that I had was, okay, so what's a difficult patient? And I've decided to make this question on my Instagram stories. I left, I think it was last Saturday, so it was during the weekend. And I had a lot of answers. So I asked, what is for you a difficult patient? And I had lots of answers from colleagues. And I think it would be interesting to name a few. So what is a difficult patient? So this is some of the answers that I've got. Someone disrespectful, not only at me, but to all the staff. Someone that it's not collaborative, anxious, and that touches my hands and makes sudden movements to any procedure that I make. Someone arrogant, complaining of other dentists. Someone making excuses for their situation, not taking responsibility for their situation. Distressful ones, after having a treatment plan explained clearly, questioning it constantly. Someone that wants to decide the treatment plan regardless of your explanations. Someone that before entered my office just went to Dr. Google. The ones that want everything for yesterday. The one that knows more than you, who doesn't want to pay what the work is worth. Those who don't want to receive help. Those who are difficult to communicate with. The ones who communicate aggressively and don't listen. And the last one, the one that it's disrespectful. The word respect and disrespectful is said here more than once. And but okay, I want to ask you, for you, what is a difficult patient? What do you consider to be a difficult patient?
I was just taking some notes here before we started, and I think we as dentists, and I've been practicing for this year is my 20th year of as a dentist, and I think I have I think I have enough experience with patients to give some advice on this that has worked for me. But I think that everything that you said, all the situations that you have said, have in the past have been distressful on me. It does not mean that they are not now, but they have been, and they will happen sooner or later to have every dentist. So all these situations that you have listed, they will happen. They will happen. You can reduce the frequency and the intensity of these sorts of of situations by some of the things that we might be talking about, like preventing them. And that's within the line of some of the things that we have talked in the past. But I think it is important that dentists understand that this will happen to them. And and from my experience in the early days of my career, these things would affect me. And this is normal, because when you have a patient that is being disrespectful to you, or writes down a complaint, or just starts to talk loud to your assistants, or just someone that loses their mind, or someone that's picky, that's always questioning things, they can be, you can, in the beginning, see that as a bigger issue than it actually is. Because you are with less experience, you have this tendency to try to please every patient. You don't have enough confidence in your skills. You think that if someone is unhappy, the word might spread and they may ruin the future of your practice. So all of these things, they are they are inside your mind, and I don't believe you can completely eliminate it. And by what I mean by this is that you have to go through them. They will happen to you. You have to go through them. And I think there is a few. I've listed a few of them, and we can talk about them. But so, what can we do to prevent that? What's the most practical way to prevent some of those? And some of those that you have listed, they are not preventable.
No. Yeah.
Because there will be some unreasonable people that will unfortunately walk into your door. There will be some of them. Some of the things are communication misunderstandings. And when we are talking about communication misunderstandings, yes, we can reduce these situations dramatically. The easiest one is to, for example, in my practice, we have this rule. The patient will always know what he or she will pay. They will always know. So, but if you ask, well, what's in the first appointment? Well, when they call the practice, we tell them, if you are going for initial examination, this is the cost. And if the patient says, well, I have a problem, I have this. So when the patient goes to the practice, we never charge more in the initial appointment, more than 70, 80 euros. Never, if it's like something that the patient was not informed, like small filling or whatever, we never charge more than that. And if it is, for example, a root canal treatment, we always tell the patient before we start, look, this is a root canal treatment. I'm talking about the patients that are coming for the first time at the practice, because the patients that are coming that have a treatment plan, they know exactly what they are going to pay. But we are talking in the specific situations where the person is going the first time in the practice. And if it's a root canal treatment, that will by far surpass the 70 or 80 euros. The doctor explains beforehand to the patient. Okay. So I think if you have this philosophy that the patient will always know what he has to pay or she has to pay, you will dramatically reduce the amount of issues. And I'm being very basic here. So the patient goes for his initial examination, then we'll send a treatment plan with everything detailed. And we've talked about make me clear, but you don't need to have make me clear. You just have to be as detailed as possible. What will be the costs? What are the payment options, etc., etc. So I think that first and foremost, we have to understand that we can prevent a lot of these things by being organized, by being good in communication. And communication is not always spending time talking to the patients. Just, for example, one of the things that I think it also works very well is that when the patient sits down in the practice, they get a welcome pack. And the welcome pack lets them know how they need to behave in the practice. Not in exactly this way, but for example, a welcome pack in my practice says that we are a multidisciplinary team. It means that you will be seen by different professionals. So that's already informed. We have a fine if you confirm an appointment, and if you don't, if you don't attend.
Hmm.
So all of these things, I think that once they sit in a place where they realize that people are making an effort to set the rules, they they understand that they have to be either they accept it or they don't accept it. So if
Hmm.
they move forward, they know that there are some rules. And I know this is a little bit blunt, but people, they want to be told what to do. We want to be told. When I go to the doctor, I want them to tell me what to do. Okay. When do I think that people have the tendency to don't have this this attitude?
Hmm.
And it happens a lot in dentistry. Is that if you go to an hairdresser, if you go to a nail store, if you go to some cosmetic place, I mean, everything that is not medical, it's more aesthetic or cosmetic, people have the tendency to feel that they are in charge. Why am I telling you this? Because there's a big difference in people's behavior when they go to the orthopedic surgeon than to the patient's behavior when they go to the dentist. And I think that dentistry has a lot of responsibility in that because we have been marketing dentistry as a cosmetic procedure and not as a medical procedure. So when you market your practice as a cosmetic place, people tend to think that things are logical. I mean, you place this there, they place a crown here, this crown will last 20 years. Whether it is whether you brush it or you don't brush it, so it's just like something very mechanical, you know. But dentistry is not mechanical only. There's a lot of things going on in dentistry. So dentistry is, in my opinion, much more medical than cosmetic. And trust me, I work a lot on aesthetics, but dentistry is mainly a medical specialty, and we tend to forget that. And if we demand, maybe demand it's a strong word, but if we expect our patients to behave as patients and not as clients, they will behave as patients. So what's the difference between the patient behavior and the client behavior? The patient behavior knows there's a lot of things out of mechanics. So health is highly dependent on the patient itself. So it's not the dentist that controls everything. They understand, the patient understand there's a degree of uncertainty. And because there's a degree of uncertainty, he must also collaborate and he must also be active in helping himself to be treated successfully. So he understands that he must also be willing to contribute and to create a positive environment. Whereas the customer is much more demanding. He wants things to be done their way. I want my hair this way. I want my nails this way. And this shift is extremely dangerous in dentistry because it's not possible to practice medicine if a patient has a customer attitude. Why am I talking about this? Because if you um, understand this attitude, the way that you market your practice, the way that you communicate to your practice, it needs to be different. Okay, I'm not saying that you need to be arrogant or this needs to be very like an hospital kind of
Hmm.
energy. It's not what I'm talking about. It must be positive because at the end of the day, dentistry is a stressful environment and you have to be positive. But never forget that the patient needs to understand this is a medical profession and there's a lot of uncertainty. You may be doing the best job ever, but if the patient does not stop smoking, they will lose the implant. You may be doing the best dentistry ever, but if the patient does not wear the mouth guard, things will break. So the patient must understand that he also has a responsibility. So I'm really talking about the root cause of many things that we are talking here. I just talked about the prevention, information about treatment plans, information about money very clearly, welcome packs explain how things work in the practice, because then basically they start to understand how they must, you are leading them off on
Hmm.
how they must behave. Well, sometimes you may think, well, but I'm just starting out. I want to get as many patients as possible. But look, whenever you allow a patient to have a customer attitude, you will sooner or later regret it. This is just my opinion. And I've just add some other stuff that we can talk. So prevention on a further level, establishing boundaries. Other things very important: staying calm and not react, which is, I think, is one of the biggest advices.
Yeah, and we can talk about that when we because we're going to discuss the how to deal in a difficult situation, right?
Exactly.
Within a difficult situation. But
when it's established,
before we go to that, let me just ask you something, because I thought that what you said was very, very interesting, and it's a very important distinction that you just made: the client and the patient, and sometimes dentistry, because dentistry has the commercial part. I think that this is a distinction that is not taught to dentists. I'm sure there will be colleagues listening to us that to just go, oh yeah, I never thought of that, because this is a very important distinction, and no one talks about it in dentistry. Sometimes it's almost I don't know if it's taboo. I don't think it's taboo, but it's something that you are not taught to distinguish. So it's not taught to you, and it's like when you are in the university, it's you are trained in a medical profession, but then when you get out, then you have the business part, right?
The private corporation, private corporation jungle.
And then if you are not aware of all of this, you start mixing, and then it can happen, just like you said. You can transform your practice into something that that even sometimes you don't identify yourself with, but you are so wrapped around costs and everything that it's difficult to get out. So it's very important what you said, the difference between clients and patients, even to get to this question, how to deal with difficult patients, because sometimes what you are dealing with is with difficult customers. And not difficult patients. So that's a very important thing, because I think, and even on the middle of those answers that I had about what you consider to be a difficult patient, you can see that clearly. You can see a difference between an anxious patient. And that's something that we can talk about, because there are some people that they are not disrespectful. They are the most sweet persons, but they have anxiety problems in the dentist. It can be due to trauma that they have been. It can be because they are anxious patients. And there are dentists that develop this labeling effect. I mean, labeling effects are one of the consequences of stress in the dentist's mental health. So it's like you start labeling your patients, and you start to have all this judgments and bias. And if you are not aware, again, self-awareness, that's so important in dentistry, that will lead you to, for example, not to distinguish what is a general anxiety from a dentist anxiety. So, and you will assume everything is dentist anxiety, and you will treat everyone as anxious, and that can lead also for you to avoid certain treatments, or to avoid certain patients, or to overtreat patients, with sedation or so. And this is well documented in the literature. So there is difficult patients because due to their anxiety and due to the fact that you develop this label effects, that you consider them to be difficult because they don't make your job easy, and then of course you need more time and appointments and all of that, or you need to send them to someone that that will treat them better, that give a better answer to them. And and this is difficult patients, and then there's difficult customers, right? There are those people coming because they argue about the price. They don't understand why they are paying. They don't recognize the value of the treatment. They are questioning you constantly, etc., etc. So I think it's important also, if you understand this difference that you just said, and I found it so important, the difference between a patient and the client, and that's why I also consider the tips that you just gave in the beginning very important. If you have a system in place, you educate your patient. You tell them from the first moment that you are there. You are also respectful to them, right? So you present them the treatment plans, all the prices. No one gets to do anything without knowing the price in advance. In the first appointment, we don't charge more than this. We have a welcome packages to the patient, saying that how we function, our values, that he's going to be seen by more than one professional. So this is information that will for sure get some of the communication barriers out of the way. One very interesting tip that I think it also helps on this is for you to have regular patient satisfaction surveys. So
Yes.
once in a while, or if you want to every patient, but if you have a satisfaction surveys, this gives not only your patient the opportunity to share their concerns, but also you take their feedback serious, and you can learn from their feedback. So I think that's very interesting also.
Yes,
to implement. But I think that this first approach, it's very, 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 very important. And you said very valuable things. Okay, so now we can pass through to the second part. So you have a difficult patient in your office, and it can be due to anxiety, because there are patients that are not disrespectful, but they are anxious. They have an anxiety problem in the dentist.
Mm-hmm.
And there are difficult patients because they are disrespectful. There are people that are disrespectful.
Yes.
And I think that, and I mean, I think every dentist think the same. This difficult patients can not only create unpleasant situations, but also they can have a negative effect on the whole staff and on the whole clinic. It's not only you that have to deal with the situation. Of course, you and even what you already mentioned, that it's in the beginning, it's very hard because we take things personally. Not only can it affect our clinic or our profession, but also we doubt ourselves. Did I provide the best service that I could? Was this my fault?
Am I good enough?
Yeah, am I good enough? Yeah, that's it. But also affects the staff and the clinic, because if usually if you have a disrespectful person, it's not only to you that person will be disrespectful. It also can be to your assistant. Yes. It also can be to your secretary. So usually it creates an unpleasant situation that can escalate. If you don't prevent it, can escalate to conflict, but also it creates a negative environment. So how can you deal with it? And you already started, right? So I think that you said that keep your communication assertive and professional. I don't think that if you to deal with a difficult patient and let's talk about the disrespectful ones. Mm-hmm. I think you should be assertive and you should be professional, because if you talk too much, sometimes it's
Yes,
not, it's
exactly.
counterproductive. It's my
Absolutely.
opinion. What do you think?
Yes, yes, absolutely. I think for the vast majority of situations, I think the number one rule is to stay calm and not overreact. I think that's the number one rule. You
Mm-hmm.
you always have to think about that the one that loses the temper um, will always lose, always. And that happens in every situation. And I think I know this is very basic, but it's very easy to get some patients get on your nerves, and you may start to talk at the same level of voice, and you may start to use the same level of language, and I think you really have to avoid that.
And
I
don't
think
you
this is the
think
most,
that's a defensive reaction? It's a reaction, huh?
of
It's a
course,
defensive
yes,
reaction. Huh?
absolutely, yes. So the number one is to stay calm, and I was placing it here connected to do not react.
Mm-hmm.
And this reaction thing is, and in the management class that I think that you attended,
Mm-hmm.
whenever I talk about reaction, I always make a little analogy with what is masculine energy and feminine energy. I always make this analogy, and whenever I talk about this, I always have the feeling I am about to be misunderstood here. But regardless of the sex, this is not what we are talking about. Even though, of course, he says some analogies in sex as well and in attraction or whatever. But you always have to realize that you are in a more, let's call it, and let's not focus too much on the charge of masculine or feminine, but whenever you are providing a service, whenever you are selling something, you are, let's call it, in a more positive, in a more masculine energy.
Mm-hmm.
Okay, while the patient or the customer is in a more feminine energy. It doesn't matter the sex.
Mm-hmm. Mm-hmm.
It may be a woman and a man. It may be a
Mm-hmm.
man. It doesn't. That's not the point here. But the thing is that in order to be attraction, and this is something that may be difficult to understand in the beginning, but in order to be attraction, there needs to be some polarity. Always, always. So it's never. I mean, in terms of respect, of course, it needs to be an equal energy. But in terms of reactiveness, it must be a different energy. So, in order for you to be in a more masculine energy, you always need to be able to be in more control of your emotions. Otherwise, you will completely lose it.
Mm-hmm.
So, we want some polarity because we want some attraction, because we want some um, rapport, let's say. Okay, this is not about sexual attraction, this is
Mm-hmm.
about rapport. In order to be rapport, you have to have some sort of polarity.
Because you
And
have
you,
something that I need.
exactly,
Yeah.
exactly. And you,
Mm-hmm.
as a service provider,
Mm-hmm.
which is exactly what you said, you are
Mm-hmm.
about to deliver something,
Mm-hmm.
so that the patient needs to accept.
Mm-hmm.
Okay, the patient who accepts it needs to trust you,
Mm-hmm.
right? And one of the most basic non-verbal ways of communication, of communicating this attractiveness, this rapport, is when you are selling something, you are always the person that is more in control of their emotions. I wouldn't say in control. I would say, I think you like this, you are more aware of your
Yeah,
emotions,
that's it.
right?
Yeah.
And if you are more aware of your emotions, you are less likely to react to a
Mm-hmm.
conflict.
Mm-hmm.
So the rule number one, whenever a conflict is established, or whenever there is a test, or when, for example, for some dentists, they may think that the fact that someone is talking about money is being disrespectful, while for the patient or for the customer, it may be a legitimate question,
Mm-hmm.
right?
It it has to be.
Of
People
course.
have to be aware of their financial.
So of course, but so look, if a dentist does not implement the basic steps that we have talked about, of course that he must understand the questions that the patient is placing. Now, if everything has been explained and even still they are uh, they are discussing the prices, that's a different story. But even still, here you always have to remember this: this person that is about to give you money for something, in a certain way, they are testing you. And this is an image that you may always have in your mind whenever people ask you questions, whenever they doubt about your capacities, because patients will do that. You must always understand that, you must always see that as a test. And if they test you, and if you react to the test, if you lose your temper, if you raise your voice, if you show emotional instability, if you show them that their question made you nervous, this polarity will drop. So basically, it's something like this. Okay, let me test this guy, and in most of the situations, it is completely unconscious. Okay, it's completely unconscious.
Mhm.
So let me test this guy, and if you react, you have lost the test. So this polarity has dropped, and what happens now is that you are no longer in the place where you have something that this person needs. Now he's basically looking at you and saying,
Mhm.
look, I don't know if he or she has what it takes to be able to handle me. I don't know if this person has what it takes to be able to handle me. So this polarity between, and I haven't talked about what happens between men and women, because of course it's much more complex, but it's a very simplified way for you to understand this feminine and masculine energy that again has nothing to do with sexes. It just has to do with the position. You may be in a more masculine energy at work, and you may be in a more energy feminine while you are in your family. It
Mhm.
doesn't matter. But if you are at work and if you are providing a service, whether you're a woman or whether you're a man, you are having something that the patient wants. And if you react, you must always have that in your mind. If you react, you lose the game,
Mhm.
let's say. So
Mhm.
when you lose the game, you lose the trust. Because you have to think about this. Someone extremely experienced will graciously deal with all the tests. Will make sometimes even a joke. So, for example, let me give you a perfect example here. Um, so, okay, this implant, um, so it will last forever, right? So this is something forever,
Yeah.
right? Well, and you can say, what do you mean forever? You may react. You may say, well, so basically what you are saying, that's, are you stupid? So you are reacting to the patient. That's one way of doing that. The other completely way of doing that is to dance around the situation, to gracefully dance with it. And that's different, which is, for example, an example. Well, and you must say that with your face and with your body, and it's not from 1 second to the other. Sometimes it takes years, but just having the mindset in the beginning of not reacting helps you a lot. But you may say, well, I'm sure, hey, uh, Mrs. Whatever, Mrs. Silva, no, look, your teeth, they are the best thing that nature could do. But look what happened to them. So, do you think there's anything that we can do as men that is better than nature? Of course, it's not. So, what happens is that this implant that we are going to do, we can guarantee you that we'll do our best to make it last as much as possible, as long as you take good care of them. And taking good care of them has always two sides: what you do at home and what you do here in the office, that you need to come. Otherwise, it's not possible to maintain that. And sometimes you can be even a little bit deeper, which is, well, but the way that you've been treating your teeth so far will have to change, right? Because otherwise you'll not be able to maintain your implants, right? Okay? So this is a way of basically not reacting, but informing the patient by grabbing the energy of the patient and dancing with it and making them understand that their tests will not affect you because you are in such a different position and you are so used to do that and you are so used to be tested and ask these questions that you find it funny and you dance around with it, which is a completely different energy. And this is a much more masculine energy than what the patient is having at the moment. And this is just an example. And of course, that I would I would ask our listeners to, I always do that, see what are the most picky questions, which are the questions that patients do to you that really touch your buttons, that really make you feel. And in the beginning, they are the questions like, you seem too young to be doing this. Do you have many cases as this? I mean, this can really be taking you, you may become really affected by this. So you have to think, how would a very experienced person respond in a professional and slightly funny way so that the patient understands that, hey, you are safe with me. I'm here to take care of you. This is not only my responsibility. I'm going to do my best, but this is also your responsibility. But we are in this together, and without drama and with a calm energy, we will fix this. And this thing about the positive and about the masculine and feminine energy and the fact that you should never react to tests or questions is, in my opinion, the most important inner game, let's say, that you have to use in patient communication if you want to avoid difficult questions, because there will always be difficult questions. Even in our practice that we have everything detailed, sometimes we have patients that says, well, hey doctor, am I not, basically, for example, we give a treatment plan to a smoker of implants, and I know it's in some countries dentists don't even do implants in smokers, but in some situations we have no options, we have to do it, right? And so the patient was informed, that's in the treatment plan. They said, well, am I going to have problems in these implants? And sometimes it's like, why is he asking this? Because this is written, we have talked to him. I mean, is it stupid? What's going on? So even though that may be on your mind because you're human, and let's face it, we may be thinking about that, we have to understand that sometimes that question, like you were saying, it may come out of a person that is not reasonable, but sometimes it's just a manifestation of stress, right? Sometimes you're just so nervous that that's what pops out of their mouth, right? So what you have to do is that you cannot not address the question. You have to tell them again. Look, Mr. John, look, yes, of course, you might have problems in these implants. Yes, you do. You might have. But how can we avoid that? You can reduce the smoking. You can have good oral hygiene, and you can come here regular so that you can benefit from a good care of that. But if you ask me, may you have problems? Well, I have to tell you yes, right? Because saying the truth is the difference between a doctor saying what is the reality, what is the truth, is the difference between the doctor and the cosmetic provider, hairdresser, manicure, whatever. And then I have nothing against them, of course. But you have to be able to tell them, will I have problems? Yes, you may have problems. Of course, you may have problems, but not in a dramatic way. Yes, you may have problems, but we are here to help you with that. And this balance is, I know it's difficult to get it. I know it takes time. But my biggest advice would be, make a list of everything that really pushes your buttons and write down a few sentences of imaginative, positive, funny, and funny expressions or sentences that you can use on the tip of your mouth. Okay.
Mm-hmm.
For example, something that I use a lot, which is, I think I told this story. There was a very unreasonable. Actually, in the last January and February, I have very, very difficult patients that I need to handle. Some of them were very difficult situations, but one of those, and this is not the difficult one, but basically she kept saying that, can you guarantee me that this papilla will go down? And I've been talking to her since day one. I'm going to do my best. I cannot guarantee you that. I'm going to do my best. I'm sure they will come down more, but I cannot do better than this. But there will be a limit. And maybe in the 10th appointment, she was with my associate, and I went there. She says, well, doctor, can you guarantee that this papilla will go down? And I said, well, I can guarantee you one thing. We are both going to die. That's the only thing I can guarantee to you. But after that, you just have to place a positive energy in the conversation, you know. So you have to look, we are going to die, but like I told you since the first day, I cannot guarantee you that they will go completely as you want, because as we have discussed earlier on, this is the situation. But you must be assertive, but never lose your temper, because the minute that you lose your temper, in their unconscious, what you are saying to them is that this guy does not have what it takes to take care of me. This guy does not have the experience and the stamina and the resilience that it takes. This guy or this girl or whatever. So always keep that in mind. Once you react, you lose the game. Always. It's always like that.
You said a lot of things, a lot of interesting things there. Let me just break them because you said many interesting things. I completely agree with what you said about reaction. It's not about reacting, it's about responding in an appropriate way. But you have to have the emotional awareness that you talked about. And that's why I think emotional intelligence is key in dentistry. It should be taught to dentists. That's what you just described. It takes a lot of emotional awareness. You have the exercise that you said, it's a wonderful exercise. Be aware of what triggers you. For me, when I started to do that exercises with me, what I discovered that one of the things, many things, but one of the first things was that usual when they enter and they say, oh, I hate dentists. You know, I felt it. When I started to be mindful of my body, I felt it. My blood pressure, even my temperature raised. I felt it.
So
When you start paying attention,
yes,
it's so many things. And that's why sometimes dentists spend their day just reacting to this. Imagine the big things, of course. But
let me ask you a question. What's your answer to that? Because I have mine.
My answer to that was smiling and don't we all do?
You know what I do?
I mean,
oh really? Really? I hate dentists as well.
Yeah,
I hate them.
Don't we all do? I smile and say,
I
don't
hate
we
them.
all?
I really hate them.
So, but you know, this is a small thing. Now imagine the big things. Imagine the difficult, real difficult, patients. But yeah,
but that is a classical one. That's a perfect. That's really that classical stuff. I hate that.
With the exercise that you just advised is a wonderful exercise. Really pay attention to what triggers you, because sometimes, and this is something that dentists need to understand. Sometimes the patients are not difficult. Sometimes it's the way that you react to patients. So that's where is the difficulty. And that's where the labeling effects come from, what I was telling before, you know, those labeling effects that the patients, that dentists develop to patients. It's just, it's a reflection of stress on the dentist's health. And it's not like we are turning here. So I know then it's not the patients that are difficult, it's the dentists that don't know how to deal with patients. No, that's not what we are doing here. But there is part of this difficulty in dealing with patients that is not being aware that you are just reacting. Okay. And so that awareness, it's very important. I highly recommend to do the exercise that you just said, and you will discover a lot. And you will discover a lot. It's really a very insightful exercise. It was for me when I start doing it. But also, you said other very interesting things. So our natural response, of course, is to get defensive. You need experience, you need emotional awareness, you need emotional intelligence to be able to bring a response, and to bring an intelligent response like the ones that you are giving nowadays. But the thing is that when you don't have that awareness, and when you get defensive, then you get in the negative mindset. And that negative mindset will lead you to to those things that we just said, to doubt yourself, to just raise your voice, and to not to explain yourself in the best way. So it will lead you to all the wrong things, and it will lead you mainly to you not be able to be proactive, to seek for
Yes.
the solution.
Solutions.
Yeah. You will continue the problem, so you will not be proactive in a solution. It's also another thing that you said that I wanted to highlight is that don't take things personally. This is a very important thing. Sometimes it's not about yourself. Sometimes you just have to, and if you do the exercise, and you said it, if you do the exercise to look things through the patient perspective. So, but okay, that requires a little bit of work. You have to get out of your own head, right? And to be able to, okay, the pause, right? Not to react and say, okay, but why is this guy asking me again if this has risks? Hey, sometimes it's just their fear coming out. Sometimes it's just their way of expressing their concerns. So, and you have to be able to get out of your head and to say, okay, wait, let me see what is going on here, right? So really be mindful also of your of what you just said of your internal bias. Is that them, or is it you?
Yes.
So this is
Yes.
very important. And sometimes it's just them. It has nothing to do with you. It's just
Most of the times.
fear
Most of the
and
times.
anxiety. That's it.
Yeah.
So I think these are very important things. And we also said this when we talked about boundaries. It needs experience. It needs
Yes.
experience.
Yes.
In the beginning,
But
it's
yeah, but
hard.
this is why I think that in the first years doing the exercise that you just said, just making a list of all the things that really trigger you, and find
Answers for
funny,
it. Yeah.
imaginative, and but informative and straight to the point
Yeah.
answers, so that you can discard so you can lay down the wall in a
Mm-hmm.
graceful way. So basically, it's just about always remind that they are testing you. They want to see how much you can handle it, and you
Mm-hmm.
just have to dance with it. And when you
Mm-hmm.
dance with it without reaction, they were like, "Oh no, this guy." Basically, you have dismantled in a positive way, and you have welcomed them into you,
Mm-hmm. Mm-hmm.
which is
Mm-hmm.
completely different than the reaction. So basically, yes, you told them the truth, but what they really want is someone that is confident enough so that they can feel safe.
Mm-hmm.
And the most complex treatments, the more they want to feel safe. The higher the amount of the plan, the more they want to feel safe. And sometimes the higher the tests.
Mm-hmm. Mm-hmm.
So, in a more basic level, it's about organization. In a more one-to-one level, it's about self-awareness, basically. Self-awareness and non-reactivity.
Yeah, and what we just said also, don't take things personally. Set
Yes.
your boundaries. Those are very
Yes.
very
Yes.
important
Yes. I
things
think that's
also.
something that would be something that I would like to be talking about next, because I would like to ask you. So I'm sure that sometimes people just get out of the limits of the boundaries. So within all that we said, sometimes you realize this is this is out of your limits of or out of what you think it's the limits of your practice, no matter what they are. They may be poor language, they may be verbal violence, and sometimes there's not to be very, just sometimes the way that people talk, or you may realize that just just too much. It's out of the, so
Hmm.
even though that we have said that yes, you should not react, there must be a time where you need to, I won't say react, I would say
Yeah.
to let go the patient. So what do you think about that?
Yes, I think so. I think there's two kinds of situations there. There's that situation that you were just saying, that someone is disrespectful in a way that you cannot tolerate it, because it's a lack of respect for you, for your team, for your work, and you have every right to say, look, I'm sorry. It's not my way of.
Sorry, let me give you an example. A patient that constantly arrives, that for the second time or third time arrives half an hour or 1 hour late. What do you do with that patient, for
Well,
example?
first you have to try to talk to him and
Yeah.
say that this is not something that the way that we work, the way that the practice work. That when he does that, it interferes with not only
With every,
your work, but
yes.
with the normal function of the practice. And if it happens again, he's not welcome anymore in the
And he needs to
practice.
find someone else, of
Someone
course.
else.
Yes.
Yeah,
Yeah.
yeah.
But I
I
think that we must be okay with that. We must be okay also with that. But go on. I'm going to give you also my 50 cents
Mhm,
on the
mhm.
on the matter. So you said
Uh,
that there were two situations. One
y-
situation is
no, I
disrespect,
was
right?
I was I was telling you that, for example, in Belgium they have something called the blacklist. So that doesn't exist in Portugal. It was something that it was new to me. But they have patients that they consider that they are not welcome in the practice, either
But
because they were disrespectful with doctors,
yes,
because they are
yes,
constantly
yeah,
late, because they miss
yeah,
appointments,
yes,
and even the software of the practice has,
as a
when the
blacklist.
yeah, when the patient, for example, misses this third appointment without noticing, the software, do you want to send this patient to the to the
Yes,
blacklist?
yes.
No, so there's
But that's also cultural, you know. That's a lot of, in Portugal, because there's a huge amount of dentists. There's this huge competition. We tend to lower the standards. That's the issue, right? But I perfectly understand what you mean, because I think that, especially for Portuguese, I know that I talk a lot about Portugal, but Portugal is a really special situation within Europe because of irresponsibility of politicians or whatever. It doesn't matter. But basically, the situation is completely out of control due to the number excess of dentists. So in in a chaotic situation, we have the tendency to lower the standards, to widen the boundaries. You know what I mean? To keep accepting patients, even though they are not good patients at all. They are respectful in many ways. They arrive late, they miss appointments, but I think it's very important what you just said, and I think that even in if you have a practice in the long term, you will realize that you will have patients that you have to place on the blacklist,
Mhm.
that you have to say no, that you have to invite to go somewhere else in a professional way, and
Yeah,
provide all the assistance to the other colleague that is dealing with them.
if you have a system in place in your practice, if you are very aware of the values that you want your practice, if you have a
Yes.
protocol, then it will be very easy to distinguish of those patients.
Yes.
Because it will be the ones that go against
Yeah.
your values, and it will be the ones that will prejudice the normal functioning of your practice.
Mhm.
So that will make that part easy. And then, of course, you have people that might be they arrive to the appointments on time, etc. But then inside of the clinic, they might be disrespectful for you, or you always questioning you, or you feel in some way that you cannot help them, right? Even if someone, and this is the second situation that I was talking about, imagine that is someone that is not disrespectful, but when you are treating him or her, you feel that you yourself are anxious, because I mean, I usually use this distinguish when dentists are working in their patient's mouth, and they feel like they are stressed, for them to make this question to themselves: can I do this? Am I able to help this person? And this is about technique. If you say yes because you learned it and you studied, then just focus and work in the flow and remember yourself of the next step. If your answer to that question is no, then, I mean, imagine this a practical situation. Imagine you are doing an endo treatment, right? And you cannot reach the measurement
apex.
of the canal, right? If you do yourself, okay, but let me try and go with the file 8 or 10, and you go in slowly and with patience, things go well, and you do it, okay? And if at a certain moment your technical knowledge is not enough, right, then you have to close it the best way you can, and you inform your patient that he needs to go to your colleague, the endo specialist, right? So that's what distinguish stress and anxiety when you are working on the mouth of the patient.
Yes.
Is when you make this question to yourself: can I do this? Do I have the technical knowledge to continue to do this? Can I help this person? And that's what you are studied for, right?
Yeah.
And you do it. But if you find that you cannot help this person, then you should find someone, and this is part of being proactive, right? You seek a solution for that person. Sometimes it might not be a technical problem. It might be someone that, due to their anxiety, doesn't open the mouth in a way that you are comfortable to work.
Yes.
It might be someone very anxious, always moving. Any movement that you do, a person moves, and you don't feel comfortable. It might be something that you are aware. Okay, this person, I don't have the trust to treat him. Again, find a solution. Be proactive, because those are difficult patients also, right? If you cannot help, find someone who can. So this is a way also of dealing with difficult patients, even if they are not disrespectful for you, but you don't feel comfortable treating them. But okay, this is already a very personal thing, right? I think that if it's disrespect, and if it doesn't go according to the clinic values, if it disrespects you and your work, and if it makes the natural flow or rhythm of the practice not going well, then you are entitled to set your boundaries and to say to that person that, okay, we cannot help you here anymore. But you are also entitled to say to someone, look, I cannot help you, but I can find you someone that can. So
yes. So
I,
basically, it's a way of okay, we've reached this. This is the best that I can do. Now I have to let go and just find
mm-hmm,
a solution that can help, and not to be overstressing myself, and
mm-hmm,
not be over demanding.
mm-hmm,
Yeah,
mm-hmm,
yeah. But I think it's I think that the way that from the basic stuff for prevention, organization, protocols, um, to then establishing the boundaries based on your protocols, to being mm, aware and staying calm and do not react, and see if it's not something that is triggering you and not exactly coming from the patient. But then in once you reach a certain level, you really have to let go. And you were saying, yes, okay, I'm doing a procedure, but it's this is out of my knowledge, so I have to refer the patient. That's number one. But also, which is what I've talked before, which is you sometimes have to invite patients to leave. Yes, and sometimes I talk for myself. I'm very direct to them, and I tell them sometimes, look. We did whatever we could to be reasonable with you, and I don't think you are being reasonable, even though we have explained you this many times. You are keep saying the same questions, and it seems like because some patients what they do is there is some, and these patients are out there. They manipulate the situation, um, and this is very important when we are talking about complex treatment plans, because some treatment plans are very expensive, right? The price is very high, not expensive, but the price is high. So when the price is high, the level of stress, the responsibility also is high, right?
mm-hmm,
And you have to be aware that some of these patients, they have very high expectations. And sometimes, even though you explained everything, they keep slowly trying to turn around the situation to make the responsibility not from you, not from them, but from you. Slowly, they do it slowly, and sometimes they do it in a more subtle way. So, how do they do it? So, let's see if this really goes well. So they don't talk about the smoking habits. They don't talk about the bad hygiene. They don't talk about the fact that they are being. They are always talking about the procedure.
mm-hmm,
They are very subtle in a way. So I consider myself to spot these patients as soon as possible. And I always tell my associates, these patients, they need to be spotted as soon as possible, not in a reactive way, but keep reminding them, hey, yes, but you're a smoker. Yes, but your hygiene is not yet good. So it's likely that you will have problems. You may have problems here. You are not using the mouth guard. You are, and I am here to help you, yes, of course, but you need to understand there's a degree of uncertainty here because, hey, this is medicine. This is not a haircut. So basically, what you are saying then is that we understand that behavior in the hair salon, but that behavior here, you cannot have that behavior here because if you are in a hospital, it's not the same behavior as you are having when you go to get your hands or your feet done. It's not the same thing. You are not saying this directly, but you are reminding them that there's a big degree of uncertainty in dentistry, and dentistry is still medicine. And once they understand that, their attitude shifts. They understand, look, yes, I am responsible for this. Even recently, I went to do exams because of COVID. I was running the treadmill with electrodes everywhere. I did a heart exam. I did lots of things. And I was thinking about, I was sitting there and I was thinking, how fragile am I here? How vulnerable am I here? How would I even dare to try to condition that we are not doing that right? You understand?
mm-hmm,
So
mm-hmm,
it does not even cross my mind.
mm-hmm,
I'm not saying that patients need to behave in the dental office like they are being treated for cancer. It's not that's not the thing that I'm doing. But there needs to be, because the thing is so unbalanced at the moment. It's so towards cosmetic and aesthetic, so more mechanical. They think I want this and I will get this. because I see this on Instagram. They just place these things, and I will look beautiful. I will look like Beyonce. Everything will be amazing. I just buy this, just like my nails. But it is not. It's not like that. And I think this message, it's not being spread enough. And I don't see that in the marketing of dentistry. I don't see that. I don't. Of course, that in marketing you cannot talk about the negative stuff, but you have to understand that many things can go wrong, even if you do things perfectly. Many things can go wrong, and it's not all your fault. And sometimes it's just, of course, it's sometimes poor diagnosis. You don't take into control of the risk factors. But in this sort of patient, that even though you have informed everything, and they keep that's never brought to the subject, the smoking, the hygiene, the functional risk. They never talk about that. They always talk about what you are going to do. They are always placing the pressure on you, and you have to keep letting them know that. You have to tell them, you have to call them to reality in a subtle, non-reactive, and sometimes funny way.
Yeah, but you know what you need to spot those patients, just like you said. Yeah, then you need to listen in an active way.
Yes.
You need to really listen when they are talking, because if they are talking and you are thinking how much you're going to charge for the for the crowns, and how do you get this to the lab, and this is going to be a next patient that you have, is the work already there, and that you are 15 minutes late, you don't spot those things. You don't see the red flags. You might even see them, but you don't act on them.
Immediately.
Yeah.
And
you have
in a
to
graceful,
act immediately. Yeah.
You have to dance with it. You have to grab that, and you have to dance with it, and just keep reminding them.
Because what happens is that you usually, those kind of things, and I already said this and I say it again, this is you feel it, it's like the
yes,
but okay, you
there's
are two in the
here.
thing. Okay, you are two. I'm already late, I have the next one already waiting, etc. And then when things go wrong, because things will eventually, and you get knew I should not have done this. Yeah, but why did you do it?
And
Because
these
you
things
ignored
are,
all
it's like
the red flags.
they for example, it happened to me even this week during an implant surgery. There was this guy that was telling me, "I'm not going to have problems with implants, am I?" He was like a heavy smoker in the middle of the surgery. And I was like, Jesus, what am I going to tell this guy? We have talked about this so many times. What am I going to tell him? Am I going to ignore it? No, you're not going to have. You cannot say this.
That's the empathy answer. That's the empathy answer. Yes. Yeah, no, don't worry.
You have to tell them, look, we have talked about this. We are now in the middle of the surgery. We have talked about this. Will you have problems? If you keep smoking like you do, I guarantee you will have problems. We can minimize them, but yes, you will have problems, just like I said in the beginning. But now we just have to do our best, and you have to behave. You have to help us, okay? So let's move on. But you cannot let this thing go. Or, for example, I really want them in aesthetics. They are not going to be too big, or they are not going to be too small, or the papilla is going down, right? Even though you have talked about this a dozen of times, because what if these patients grab it? If they grab from you any sort of sign that you are going to say what they want to hear, they will charge you that. They will charge you that because sometimes patients are very demanding, and you really have to spot them as soon as possible and just say, like I told you in the beginning, no. But I've already have some patients that I've told them, look, I don't think your expectations are being in the middle of the treatment. Sometimes with prevention, look, I think your expectations are not according to what I saw in the beginning. I think that you are ignoring what you have told you in the beginning. And because of that, I think you have to consider you pay what we did until now. And I'm happy to refer you to some other colleague if you want, or you can ask for some other opinion. But it's very uncomfortable for me to be working with a patient that does not listen to me, because this is what we are talking is very important. And I tell them the analogy, look, this is not about cutting your hair, this is about treating your health. Okay, so you cannot talk to me if I was an hairdresser, because you are ignoring the most important thing, which is your own medical conditions. And I tell them very, very clearly. And also, of course, this comes from experience, but it's always better, because if you let these sorts of situations pass by, they will catch you later on. And sometimes it's better really to let go the patient in some situations, because some patients, they can really be unreasonable, and you have to, like you said, you have to spot them. And it's true, it does come from experience, it does come, but you,
Yeah,
you you have to
and you
spot
also
these
need
things.
time. Okay, you need to
Of
listen.
course,
You need
of
also
course.
to give them time to talk and to acknowledge
Yes,
the situation.
yes. And this is
This is
this is
very
why
important.
this is why it is so important, the initial examination. I keep telling this. The initial examination have the mental time, not to be selling but to be informing. Just gather information. If it is a complex treatment plan, a second appointment just to talk to the patient. You have no idea how much treatment you are able to do, number one, and how much patients that you should not be treating, that actually will understand that they should not go for the treatment, which is equally important.
Mm-hmm, mm-hmm,
So this is why I always talk about initial examination, as it is like, I don't think it's possible to do um, more complex dentistry, aesthetics or rehabilitation now, because it's impossible not to do that without initial examination,
mm-hmm,
proper mental and chronological time to see the patient and to talk to the patient.
mm-hmm. Yeah. Okay, just to wrap it up, because it's already 1 hour that we are talking. Um, so, dealing with difficult patients, keep your communication assertive and professional.
Yeah.
Remain calm, speak in a calm way. Don't get defensive.
Don't
Don't
get
react.
reactive.
Don't get reactive. See if you can bring a response. So respond in an appropriate way, in a way that puts you in a positive mindset,
Yes.
not in a negative one. Be mindful of your verbal language and non-verbal language also. So your body also says a lot. What's your body tension, your and you might be saying something, but then you are showing a completely
Different
other
thing.
thing. So be mindful of that also. Practice active listening. It's a very, very important thing. You will, of course, need time for this, and you need self-awareness, the awareness that we've been talking about. You need the emotional awareness also, not to be reactive. But give your patients time also to explain what they want, and to acknowledge the situation. And if there is a situation that needs to be acknowledged, give them time also to explain their point of view. You can also, sometimes the situation, we said that you have to let them tell their story, because sometimes it's just their fear coming out. We said that sometimes it's just their reaction, so don't get reactive on their reaction. Set boundaries, don't take it personally. And I think that's also, be proactive. Always keep the solution in mind. Always keep the difficult patient, the difficult situation with try to find a solution, not to maintain the problem, but to find a solution. And sometimes the solution might pass through let the patient go, or to find help with another colleague. And also, if I might add, and I think I've been telling this in all the episodes, so but I'm going to say it again. If I might add, ground yourself. Exercise, meditate, do yoga, do breathing exercises, whatever do you
Give
feel
some
right.
punches if that's your style.
Yeah, but you
Give some
need,
punches in the back.
yeah, you need to ground yourself to have better self-care, and need to have better self-care. And
Yeah.
this will help
Yeah.
you to be more centered mentally. You will be more
Yeah.
fit for a response instead of a reaction. So I think this
And
is
one thing
important.
that I think makes a lot, which is you will never please everyone, and you
Yeah.
must be okay with that. You will sometimes. We have not talked also about, and this is a really fast one. Dissatisfaction of a patient because of a mistake you made, a communication mistake that you have made. So number one, assume the mistake, and always compensate the patient for that. Whenever you do a mistake, you should always assume that mistake. Most of the times, it's not a technical mistake, because but it's most of the times it's a communication mistake. So he wasn't completely informed about the price, and if that is the case, you have to assume that, and compensate the patient. So that is really, really important. And I forgot what I was talking about.
No, we were talking about all. I think I covered all the tips, the practical tips that you can
Oh, I
have.
remember that you will not please everyone.
Yeah.
You will not please everyone. You will not always be the best.
The best dentist to everyone.
The best. There's always better dentists than you. There's always going to be, and sometimes it's not a better. Sometimes there's one that particular patient likes more. Sometimes not a technical shit. It's just a question of compatibility, and you have to be okay with that. And this is why I think what you were saying is very important. You have to give yourself value outside of dentistry. You have to value yourself as a human being, either as a husband, as a boyfriend, as a girlfriend, as a friend, as a sporter, as a sport guy, whatever. You have to find reasons outside of dentistry to feel good about yourself. And by the way, you don't need to be any of those things. You don't need to be a husband or a wife. You just have to be you, and you have to be okay with you. And that is much more important than being a good dentist.
Yeah.
So I think this is a really important message, that don't rely your importance on how successful you are in dentistry, because you are way, way, way more than that.
True. And but and again, we said this on a different episode. Dentistry is a high performance job.
Yes.
And if you are not mentally fit, if you are not physically fit, it will be very hard.
I always
dealing with difficult
think,
patients, being exhausted, mentally exhausted.
Yes.
Every day waking up with this sensation, I don't want to do this. It's very hard.
I think I find this analogy very good, and we talked about this many times, and you keep saying that there's no such thing as work-life balance. It's so like a mix. And I would say it's like a dance, you have to dance with the profession. Sometimes the dance is fluid, sometimes the dance is not fluid, sometimes the profession likes you, sometimes the profession doesn't like you. And sometimes it's in a good day or it's in a bad day, but you still have to dance and have fun and doing your best as much as you can.
I read this quote that I found so interesting from I think it was Simon Sinek that put it. He said, if you have to remember yourself during your workday of how much you are earning, then it's because you don't like what you do. You're not having fun on what you are doing.
Yes, and there's also one thing very interesting from him, is that he says that the biggest goal of a company is not to make money. And that is very provocative because, of course, you have to make money. And but I understand what he means is that the reason why you create a company or a business is that you have to bring something different to the world. You have to make your job an expression, an extension of what you believe.
Mm-hmm.
So I
Mm-hmm.
think that is more important than making money. Of course, you have to make
Mm-hmm.
money, but you have to bring something new to the table. You have to make
Mm-hmm.
things in a different way.
Mm-hmm.
Maybe it's your philosophy, maybe it's
Yeah, and no one is taking the importance of money here. Of course,
yeah,
money is important, but it should not be the only reason why
of
you
course.
are
Yeah,
doing what you are doing, and you should have fun with it, and you
yeah.
should enjoy your profession. So I hope this conversation and this tips were useful for
I would talk.
some.
I would talk here all day because I
Yeah.
have so many stories of difficult patients. Some
Mm-hmm.
that I think I did well, some that I think I was completely overrun by them.
Mm-hmm.
But I think
Mm-hmm.
that in further episodes we'll be able to
Yeah.
talk about it because I find this a
Mm-hmm.
very very interesting subject. And like you saw, dentists are highly interested on this because it's the center of their conversations when they gather together.
Yeah. Yeah.
All these
True.
patients, all
Difficult
these
patients.
yeah.
Yeah. Difficult patients, and patients are what a major stress agents in the daily stress of dentists, and most of it is communication, like you said. So
Mhm,
when we break it down, when they
mhm.
say when I ask what causes you stress, and the answer is patience, and then I start to go a little bit deeper, most of the times it has to do with communication. It has to
Yeah,
do with
yeah.
communication. That's why communication is so
It's so
important
important.
in
Yeah,
dentistry. And the other part is the lack of awareness, the emotional awareness, the reactiveness, the
yeah,
what we just talked, the not realizing that they are just reacting to the patient. So it's not actually the patient, is the reaction that they bring. But okay, let me just finish by saying that we are going to talk about this in our conscious leadership course, because leadership nowadays equals emotional intelligence. So,
absolutely,
and it equals also
absolutely.
having good systems in place to be able to put your values in practice, and to have a stress-free dentistry. So we're going to talk about all of this in our conscience leadership course. If you want to know more, just go to softbites.online. All the information is there. And it's going to be 3, 4, and 5 of March in beautiful Sagres in the south of Portugal.
I know it's going to be some awesome days that we're going to have a lot of fun and we are going to learn and share with each other. And I'm looking forward to that. I'm looking forward to go to the south. I haven't been for more than 3 or 4 months to the south, so I'm really looking forward to that. And I'm 100% sure we'll have a lot of fun and we will all get out of there better than we went to.
Yes, I'm looking forward to. I'm looking forward to it. So thank you everyone for listening to us. I hope this was useful. If you have any questions or suggestions or comments, please feel free to reach out. We would love to hear your thoughts on our conversations. And thank you, André. Thank you so much.
Thank you so much again, Manuela, for these weekly therapeutic sessions, at least for me.
Okay, bye bye,
Bye
everyone.
bye. Take
Bye.
care.